heard the president trying to minimize.
No. Well, I'm not minimizing it, but I think we should also have proper perspective. When we went into this, there were people saying that 20-year-old was just as at risk as a 90-year-old, and that's just not factually true. We know where the risk is. We know who the comorbidities that are impacted. We've got data on this now. We know who the folks who are more vulnerable, who need to be protected. So it's a very serious thing, and I don't think he was trying to minimize it, but I mean, clearly we viewed it as serious from the beginning in January when we were monitoring it. But at the same time, when you hear news about cases, I just think that should be put in the proper context and perspective that the #1 age for cases in Florida is 21, and if you're 21 and you don't have significant comorbidities, your fatality rate is pretty much zero with that. And so that's good to me. That's comforting to know when you see the cases that it's affecting folks who are less likely to see clinical consequences than some folks. And I've said this before, even before we started to see more cases. From a clinical perspective, 1,000 cases under the age of 30 is going to be less significant than 50 cases in a long-term care facility. That's just the way this virus works. It's very much dependent on age and on the comorbidities.
Hey, NBC News viewers, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.